Hi guys, we are discussing male pattern hair losses treatments with medication, and medication is finasteride and minoxidil and low laser therapy. So we are discussing finasteride today, and finasteride, what does it do is it halts the production of DHT dihydrotestosterone by 60% for few hours. Finasteride remains in the blood for 6 hours, and it can stop the production of it inhibits the production of synthesis of dihydrotestosterone for 6 hours, up to 60% of the production. And if you're gonna give it 4 times a day, like one in the morning, one after 6 hours, then after 6 hours, then after 6 hours, then you can block 60% of production of DHT for 24 hours. So this is the treatment. This is very much needed in any age, because androgenetic alopecia and male pattern hair loss starts usually in early 20s, and it can keep going up to the age of 80. So at any age, it can be given safely for few months or for few years.